I'm Dr. Shilpa Nath. I'm a first-year resident here, and I completed my medical school at Western University, right close by in Pomona, California. I was one of those little kids that ever since I was a child, I wanted to be a doctor. I had like the little toy set with the plastic stethoscope and everything, probably because I had really great physicians growing up. I had a really great pediatrician that I was able to really share things with, and they were such a positive influence in my life that it was just a career that I had wanted ever since I was a little kid. In high school, I started out volunteering at my community hospital in the urgent care. I continued with that background. I went into college, I majored in biology and did all the pre-med things to get into medical school. I minored in global health as well because I have an interest in community service and caring for socioeconomically underserved communities. It was my first rotation in medical school, and I remember one of my very first patients, they came in with, it was an elderly patient, they came in disoriented, and it was because of a urinary tract infection, and gave them antibiotics, and then within the next day or two, they were kind of just back to themselves. So being able to make that difference in people's lives every single day as an internal medicine physician, that's really what drew me to internal medicine. And what I love about being a hospitalist, that's what my future career goal is that we're able to check in with our patients every day and kind of guide them through this scary process of being in the hospital. So that's really what I love the most about being an internal medicine resident and future hospitalist, that I'm able to kind of form these relationships, whether they be, for a day, for a week, if, God forbid, they're readmitted to the hospital again, but just being able to kind of have that connection with patients every day. That's really what I love about internal medicine. As soon as I found out that I was going to be, staying in this community that, I started serving in medical school, I was so ecstatic. And to know that it would be at San Antonio Regional Hospital, I was, even more excited. I've been serving this community since I was in medical school, and to be the inaugural class is just such a privilege. I really have the honor to be able to kind of shape the direction that the residency program is going and really set the legacy. And so it's been such a privilege and such an exciting opportunity to be part of the first residency class. I'm just so excited that I get to continue caring for this population that I was serving in medical school and the next 3 years and hopefully beyond.
San Antonio Regional Hospital. Here for life.